Sometimes one story changes everything. Sometimes one patient makes you rethink everything you've learned over the years. And sometimes that story becomes so incredible that people simply can't believe it. Today, I want to tell you exactly such a story. A story that literally exploded on the internet when my patient shared it on social media. A story about how a man who was told by 3 different surgeons that he would never walk normally again without surgery not only avoided the operating table, but ran a half marathon 6 months later. His name is Michael. When he first came to see me, he was 54 years old, former professional soccer player, then coach, all his life in motion, all his life in sports. And for the past 2 years, his right knee turned every day into torture. The pain was so severe, he could no longer train children, couldn't play with his grandchildren, couldn't even sleep normally. He woke up at night from pain when he accidentally rolled on his side. Michael had been through everything: physical therapy, massage, acupuncture, endless courses of anti-inflammatories, 3 hyaluronic acid injections in the joint. Nothing helped. Pain kept coming back. MRI showed what he feared seeing: advanced stage 3 arthritis, almost complete destruction of the medial meniscus, significant cartilage thinning, bone growths. Classic picture for total knee replacement. 3 surgeons he consulted said the same thing. You need surgery. Conservative treatment in your case is futile. We'll replace the joint and you'll forget about the pain. Michael was ready to agree. He was desperate, but his wife, who works as a rehabilitation specialist, said, "Let's try one more doctor. The one I heard takes a different approach to such cases." When Michael entered my office, I saw a person who had mentally accepted surgery. He brought a whole folder of documents, images, reports, test results, everything neatly arranged by date. I looked at his MRI. Yes, the picture was serious, but I'd seen worse cases where people lived pain-free. I asked him to stand and walk, asked him to squat, asked him to rise on one leg. And then I saw what the MRI didn't show. His quadriceps, the main thigh muscle, practically wasn't working. When he squatted, all the work was done by other muscles. And the knee wobbled, unstable, unprotected. His glutes were weak. Calf muscles overtensed and shortened. Foot collapsed inward when walking. His whole body compensated for weakness of certain muscles, and this created wrong biomechanics that destroyed the knee even faster. I told him, "Michael, yes, your joint is damaged. Yes, the changes are serious. But I don't think pain comes from these structural damages. I think pain comes from your muscles no longer protecting the joint, and it's receiving load it's not designed for." He looked at me skeptically. "Doctor, 3 surgeons told me I need surgery. You think they're all wrong?" I answered honestly, "They're not wrong in what they see on images. But images don't show pain. Images show structure. And pain is created by function. And if we restore function, there's a chance pain will go away, even with changes that remain on images." I offered him a deal. Give me 3 months. 3 months of intensive, targeted rehabilitation. If after 3 months there's no improvement, he goes for surgery. But if there is improvement, we continue working. Michael agreed, not because he believed, but because he had nothing to lose. We started with diagnosing each muscle group around his knee, found that his quadriceps had lost about 60% of strength compared to the healthy leg. 60%! That's a huge loss. His gluteus medius practically didn't activate. Deep hip stabilizers were asleep. The first 2 weeks we did only one thing: taught his muscles to turn on again. Isometric contractions, very gentle, without pain. 5 minutes 3 times a day. Sounds ridiculously little, right? But this was critically important work. We were restoring neuromuscular connection that had been severed by pain. After 2 weeks, Michael said pain became slightly less, not much, about 20%, but it was something. We added joint mobilization, very delicate, then started working on walking biomechanics. Turned out he'd been walking wrong for about 10 years, compensating for old injuries. Each step created additional load on the medial part of the knee, exactly where cartilage was most destroyed. By the end of the first month, pain decreased by about 40%. Michael could sleep normally now, could walk 30 minutes without stopping. He started believing this works. We added strength exercises, started with minimal weights, focusing on proper technique and activating the right muscles. The second month was a breakthrough. Michael started feeling how his leg became stronger. Quadriceps finally woke up and started doing its job. Knee became more stable. Pain continued decreasing. By the end of the second month, he rated it as 2 out of 10, and only after prolonged activity. On the third month, Michael came to me and said, "Doctor, yesterday I played soccer with my grandson. I couldn't do this for 2 years. I played 20 minutes and the knee held up. I saw tears in his eyes. These were tears of relief, joy, gratitude." We did a follow-up MRI. The joint looked the same as 3 months ago. Cartilage didn't magically regenerate. Meniscus didn't heal. Bone growths remained in place. But Michael lived without pain because his muscles now protected the joint, stabilized it, properly distributed the load. 6 months later, Michael wrote a post on his Instagram. He told the whole story. How 3 doctors said surgery was needed. How he found me. How we worked. How he avoided surgery and returned to active life. He attached photos of his MRI with caption, "This is the knee that needs replacement," and this same knee that ran a half marathon yesterday. The post exploded. In a week, it was viewed by over 2 million people. People shared it by thousands. Some wrote, "This is impossible. It's fake." Some wrote, "Thank you. You gave me hope." Journalists started calling me, asking if this was true. Other doctors wrote that I was giving false hope to people, that not all cases are like this. And they're right. Not all cases are like this. There are situations when surgery is truly necessary. When mechanical joint blockage prevents movement. When pain responds to nothing. When quality of life suffers so much that surgery is the only way out. I never say surgery isn't needed for anyone at all. But I say surgery shouldn't be the first choice. That before cutting, you need to exhaust all conservative possibilities. And by conservative treatment, I don't mean a couple weeks of physical therapy and a handful of pills. I mean serious, structured, targeted, neuromuscular rehabilitation under control of a specialist who understands biomechanics and functional anatomy. Michael's story exploded on the internet because it gave people what they lacked, hope. In a world where medicine has become too fast, too technological, too dependent on images and numbers, this story reminded that the body is capable of amazing things if given the right tools. After that post, 15 to 20 new patients started coming to me weekly, all with the same question. "Doctor, I was told I need surgery. Can you help me like you helped Michael?" And every time I explain the same thing, I'm not a magician. I don't have a secret method. All I do is return people's understanding of how their body works, teach their muscles to protect joints again, correct biomechanical errors. This takes time. This requires effort from the patient themselves. This requires patience. Results don't come in a week or two, but when they come, they're real. Not temporary relief from an injection that passes in a month. Not masking pain with pills, but real function restoration. Michael still comes to me every 3 months for checkups. It's been 1.5 years since our first meeting. He not only runs and plays soccer, he returned to coaching, he travels with his wife, he lives a full life without surgery, with the same MRI changes that were there 1.5 years ago. And you know what's most important? He didn't just avoid surgery. He learned to understand his body. He knows what exercises to do to keep muscles strong. He knows how to move correctly. He knows early signs of overload and how to respond to them. He became an expert on his own body. His story isn't a miracle. It's physiology. It's biomechanics. It's understanding that a joint doesn't exist in isolation, that it's part of a complex system, and that this system can be tuned to work even with damaged elements. When people ask me if I guarantee the same result to everyone, I honestly answer no. Each case is individual. But I guarantee one thing. If you're ready to work, if you're ready to give yourself a chance, if you're not rushing under the knife, we'll try. And In most cases, far more than you think, it works. Michael's story exploded on the internet because it's true, because it shows an alternative, because it proves surgery isn't always necessary. Sometimes all your knee needs is strong muscles, proper movement, and time. Give your body this chance. Perhaps you too will become such a story that gives hope to thousands of other people.